Hello and welcome back to revise GCSE history.co.uk. This is the 6th and final video in the topic of medicine in the 19th century, and in this video today we're going to be looking at public health in industrial towns in the 1800s. I'm afraid this is going to be quite a long video today, as public health is a massive topic, so we've got lots of information to get through, so I'll try and whiz through it as quick as possible, making the video short as possible for you guys. Okay, so what health problems were there in the early... What public health problems were there in the early 1800s? So houses were built as close together as possible... good start. As close together as possible, as more people crowded into factory towns to work. There was also no public transport in industrial towns, so workers had to try and live as close to the factories as possible, so that's why houses were built very close to each other. That meant that disease could spread easily and rapidly. Towns could not cope with the need to provide people with water and sewage disposal facilities because of the growing population. In these squalid conditions, diseases spread rapidly and easily. Conditions were so bad that many people's health may have been worse than ever before. People really didn't know what was causing disease. So if people knew what was actually causing disease, they'll be able to do something about public health. But they didn't know anything about this. And as I've just said, more on this soon. We're going to talk about this in a minute. Didn't know. Alright, so during the late 18th century and the first half of the 19th century, conditions in many British towns became worse than ever. So we're talking like 80s to 1950s, sort of that time, so to 1850s, when the Industrial Revolution's going on, basically. Alright, so we've looked at this slide previously in a previous video, but we're just going to remind ourselves, they didn't know that germs caused disease in the 19th century, so what did they think was causing disease? If they knew that germs caused disease, they could have done something to improve people's public health, but they didn't. They thought disease was caused by miasma, contagion, God, or spontaneous generation. I'm not going to read through the stuff at the side. As I've said, we've looked at it in a previous video, so pause the video, read through it yourself if you think you need to go over that again. The battle to improving public health. Some people thought that the government should force local councils to clean up their towns. However, there was another group of people that said the government shouldn't interfere. They had what we call laissez-faire attitudes, French word, laissez-faire. And their laissez-faire attitude is sort of leave it alone, let it be, don't get involved, leave us to it. They believed that the government should allow each local area to control its own affairs. That meant that local ratepayers, and by ratepayers we mean the taxpayers, the landlords and such, made all the decisions. Local ratepayers didn't want the government to force them to pay for improvements in their towns, as this would increase... Alright, I'll not be lazy. As that would increase their taxes if they made improvements. So I've got a little thing down here that demonstrates it. The battle to improving public health in the 1800s is just like a tug of war. So on this side, we've got the ratepayers, if you like, and some of the things they would be shouting is, we don't want improvements, the government should leave us be. So that's the ratepayers, and these people were sometimes nicknamed the Dirty Party. Those who didn't want the government to force people to clean up, the Dirty Party. On the other side, we've got poorer people who are suffering from poverty and ill health due to the poor living conditions. We've got, we need the government to make councils clean up towns, or force ratepayers to cough up. So, this sort of a tug of war going off throughout the 1800s, and this is the battle to improving public health. So we've got ratepayers versus these poorer people. So let's have a look at some other stuff. So our first individual in the quest of improving public health is Edwin Chadwick, and he was a civil servant. He was asked by the government in 1842 to report on the living condition to report on the third time lucky, living conditions and health of the poor. Chadwick concluded that poverty was caused by ill health, which was caused by terrible conditions in which the poor people lived. So, we've got terrible conditions. That leads to ill health, people becoming ill. This is poor people. And that leads to poverty. So he said that poverty was caused by ill health, caused by terrible conditions. Basically, the terrible conditions cause ill health and cause poverty. This was Chadwick's main ideology, and that is what, it's a bit funny that, this was Chadwick's main ideology, and that is what he's famous for. So you really do need to be aware of this key point. He said that ratepayers can actually cut their taxes and save money in the long run by looking after the poor and spending money on improving their health. So basically, it would be economically better if ratepayers actually paid for improvements and improved the health of poor, as it would cost them less money. And he wrote a report called a report on the sanitary conditions of the third time lucky, sorry I'm not good at underlining date, of the labouring population, published in 1842, you do need to know that date, and Chadwick said in this report that industrial towns should take 3 measures. The first, that they should organise drainage and refuse collection, provide a pure water supply, and appoint a medical officer of health. So that's what Chadwick said industrial towns should do. And for over 30 years an argument went on about the need for councils or the government to take action. Towns such as Liverpool and Manchester led the way as they did start to take action. So what happens next? We've got the 1848 Public Health Act. So, after the work of Chadwick, at first the government did nothing about about Chadwick's recommendations. However, in 1848 there was another outbreak of cholera, and this put pressure on the government to do something. Parliament reluctantly agreed to pass the 1848 First Public Health Act. So the 1848 Public Health Act, the First Public Health Act. Although this act was not compulsory, it was optional, towns could choose if they took measures or not. The government set up a board of health to encourage but not force local authorities to improve conditions. So it's encouraging but not force. They gave local authorities money to make improvements in the areas if they had the support of a local ratepayers. Ratepayers won't want to be forced to pay for improvements, if we remember, and only a few local authorities took any new measures, and by 1872 only 50 medical officers of health had been appointed, and the Board of Health was abandoned in 1848. The 1848 Public Health Act said that they should provide a clean water supply, drainage and refuse collection, and appoint a medical officer of health. So basically, Chadwick's recommendations in the 1848 Public Health Act, these 3 things on this slide here are being made optional in the 1848 Public Health Act for towns to provide them measures. So it's not compulsory. That is the key thing you need to know about the 1848 Public Health Act. That is not compulsory, and that explains why it basically did nothing. So in 1854, we've got another individual, and that is John Snow. Dr. John Snow. He was a London doctor. So Snow proved that there was a link between cholera and water supply. He used research, observation and door-to-door interviews to build up a detailed map of a cholera epidemic in the Broad Street area of London. Broad Street is in Soho, London. And this map up here to the right shows the map that John Snow built up. These little dots show where a cholera case where a cholera case is, and the water pumps in the Broad Street area are also located on the map. And they actually found that all the deaths had taken place within a short distance of the water pumps. Near to the pump there was a brewery, and none of the people there had cholera. The brewery had its own water pump, and the men were also given free beer to drink too. Beer was sterilised because the brewing process involves boiling water, and that killed the cholera germs. And also, men were given water from the brewery's own water pump too. So these men at the brewery didn't use the pump at all, so that was key to explaining how John Snow made the link between cholera and dirty water. After collecting evidence, John Snow removed the handle from the Broad Street pump. There were no more deaths. It later came to light that a cesspool near the water pump had a crack lining which allowed the contents to contaminate the drinking water, and the Snow then put pressure on water companies to clean up their water supplies. So that's the work of John Snow. In 1858, we've also got the Great Stink. I've not actually pointed out that all these dates I'm putting as my titles. Do learn them, this is so important. So for many years, human waste had made its way from latrines in London, latrines are toilets, into the River Thames. So human waste simply being dumped in the River Thames. In 1858, the hot weather caused a great stink, and a putrid smell was right under Parliament's nose. Parliament even considered moving upstream to Henley-on-Thames, and had to coat their curtains with a deodorant to get rid of the awful smell. The Great Stink prompted Parliament to sort out London's poor sewage and drainage system and to clean up the River Thames, so it prompted Parliament. Within a year, Sir Joseph Bazalgette had begun to build an extensive system of sewers and drains that are still in operation in London today. So, as a result of the Great Stink, Parliament thought, oh, how awful, the Thames needs cleaning up, sewers need building, drains need putting in. Within a year of all this happening, a man called Sir Joseph Bazalgette, you need to know the name, began to build sewers that are still in operation in London today. So, if you think back to a previous video, we've looked at Louis Pasteur and germ theory. It's relevant bringing his work in here to explain how it was important in the provision of public health measures in the 1800s. So Pasteur published his germ theory in 1861. In 1864 he conducted public experiments to convince scientists that disease is caused by germs. Pasteur proved the link between dirt and disease, third time lucky, showing that Edwin Chadwick and John Snow had previously been correct. With scientific evidence, people were more willing to pay taxes to cover the cost of public health improvements. So Pasteur and his germ theory basically scientifically proved that dirt and disease cause illness, and with scientific evidence, people were more willing to cough up. The 1867 Second Reform Act is also important in the provision of public health measures. Working class men were given the right to vote as a result of this Reformation Act. It was no longer just the ratepayers that got a say, and for the first time members of Parliament, MPs, were forced to listen to the poor and improve their living conditions. Before this, it was just the ratepayers, the rich landowners and landlords that actually were able to vote and got a say in making decisions and stuff. So finally, this is sort of the end of public health because this sorts it all out. The 1875 Public Health Act. This was different to the first Public Health Act introduced in 1848, as the second Public Health Act actually forced local authorities to introduce the following measures. So there are three measures you need to know. Same measures as the 1848 Act, but everybody had to do them. There was no choice. Towns had to put in these measures. So they had to provide clean water, proper drainage and sewage systems, and they had to appoint a medical officer of health. But why was the Act introduced in 1875, and why was it so successful? So here are some factors that led to the introduction of the 1875 Public Health Act. The first is scientific developments. In 1861, Pasteur published his germ theory, which proved the link between dirt and disease. With scientific proof, People were more willing to pay taxes to cover the cost of public health reforms. New voters. Working class men were given the right to vote in 1867 as a result of the Second Reform Act. MPs were more likely to take notice of victims of poor public health. Statistics. The government started to publish statistics of where death rates were at the highest and what people died of. The statistics shamed some unhealthy towns into action. Also, cholera outbreaks. This is key. We're going to look more at this in a second. When cholera returned in 1865 and the link between dirty water and disease had finally been proven by John Snow, ratepayers were finally prepared to take action to improve public health. Weakening of laissez-faire attitudes, the government saw it could no longer leave public health measures to individuals or councils and realised that the government had to take action. This was becoming serious. A point that's just of interest really, you don't need to know this for the exam, it just helps to clear stuff up in your mind. The Public Health Act of 1875 was very, very, very effective, and by 1900 most British towns had built effective hygiene and water systems. So, what were the final results of the Public Health Act of 1875? It led to further stuff. So, improved standards of housing, stopped pollution of rivers from what people got drinking water out of, shortened working hours in factories for women and children, made it illegal to add ingredients that made food unhealthy. I've not actually mentioned this in this video, but you may be sorry, let me put my teeth in. But you may remember from your history lessons that a problem with public health in the early 1800s is that people put unhealthy ingredients in food, such as wood chippings, to make food healthier so they could make more money. This was now made illegal after 1875. Education was made compulsory, and vaccination was also made compulsory. So here's a quick summary of public health from 1800 to present day. This arrow is just showing the progression of time. So summary of all the progress made. So we've got limited public health schemes. In 1830 a few towns introduced drains, sewers, rubbish collectors and clean water, but most were still very dirty. Towns such as Manchester, Liverpool did. Leeds wasn't bad, it came a bit after 1830 though. Then we've got an optional public health approach. In 1848, the first Public Health Act was introduced, and towns could set up a Board of Health if 10% of people voted for it. A compulsory approach. In 1875, the second Public Health Act was introduced, and councils were forced to provide basic sanitation and appoint medical officers of health. And then we've got a comprehensive public health scheme. From cradle to grave, we've got the introduction of the NHS, we've got liberal reforms, pensions, national insurance and the NHS, and we're going to be looking at this more next topic in medicine in the 20th century. So that is a quick summary. I've also briefly spoke about cholera whilst we've gone through this video. There are 4 Britain that you need to be aware of. There's an epidemic 1831 to 2, 1848 to 9, 1853 to 4, and 1865. This table here shows each of the death rates from each epidemic, but to be honest you don't need to learn that. If I was you, I'd just learn this box up here that shows all of the cholera epidemics in Britain. So that is all the knowledge covered in this video today. Here I've got 2 slides of quick knowledge recall questions. I've actually got 8 questions because the video is so massive today. I've got 8 questions for you to have a go at. You may wish to pause the video here. I'm trying to show you all the questions at once. You may wish to pause the video here, jot down some answers to the questions, and then we'll go through them together. Okay, so question 1 from part A. Give a reason why public health was so bad in industrial towns in the early 1800s. People didn't know what caused disease. I'd say that's probably the most important. So they didn't know dirt was causing disease. What was Chadwick's main ideology about improving conditions? Well, he said that poor living conditions, I pointed this out at the time, how important it was. They cause ill health, and they cause poverty, I think the way I phrased it on my slide is that poverty is caused by ill health, which is caused by the poor living conditions of the poor. What was the problem with the 1848 Public Health Act? It was not compulsory. Towns were not forced to introduce measures. What did John Snow do, and when did he do it? Well, he worked in 1854. He proved... whoops. Link between cholera and dirty water supply. Whoops. So there we are, there are the answers to the 4 questions on this slide. Let's have a look at these ones. Question 1, how did the Great Stink... You may wish to pause here, sorry if you've not done so already. Here are the answers then. How did the Great Stink influence public health improvements? Prompted Parliament to build sewers and drains and clean up the Thames. What was the significance of Louis Pasteur's germ theory? Scientific evidence that germs cause disease. So basically, there was now scientific proof that these dirty conditions in which people were living in were causing them to become unwell, and with scientific proof, ratepayers were more willing to pay for improvements in public health. What were the 3 main measures that industrial towns were forced to take due to the 1875 Public Health Act? Clean water supply, to provide a clean water supply, drainage systems and refuse collection. Appoint a medical officer of health. Give 2 results of the 1875 Public Health Act. Shorten working hours. Could be one. You could have any off the slide really. Here's 2 that I can think of. And education was made compulsory. Just squeeze that in there. Education compulsory. Alright, so there are the answers to the quick 4 quiz questions from part B of the questions for this video. Thank you for watching this video today. I am aware that this video is massively long. There's just absolutely tons of stuff you need to know about public health. So thanks for watching this video today. Sorry if I spoke really fast. You may wish to go over it a couple more times just to get these ideas clear. I was just speaking really fast because I was conscious about how long this video is going to be. Thanks for watching. If you found it useful, head over to the website revisegcsehistory.co.uk where you can watch more revision videos and view a comprehensive range of revision materials based on GCSE history. Thanks for watching. See you soon.